So on countdown of 4, ma'am,
Yeah.
we will go live.
Right. Kritika, I hope you're ready, Kritika.
Yes, ma'am, I'm ready, ma'am.
Right.
Is my slide visible, ma'am?
Yes, absolutely. Perfect.
1, 2, 3, 4. Ma'am, we are live now.
Okay. Good evening, respected teachers, seniors, colleagues, and dear friends. A very warm welcome to one and all. Nimmellerigu Atmiya Swagata. What a glorious year it has been for Win India. Completing their first year, winning their first award, presenting posters in an international conference, and conducting a hugely successful conference themselves. So it has been a great honor to be associated with Win India, and now it gives me immense pleasure to be here for the inaugural Win Karnataka chapter meeting. This could not have been possible without the help and support of all of you present here, and of course, Dr. Maitri's persistence. Without further ado, let's start today's meeting. For the first session, we have the presidential address by Dr. Urmila Anand ma'am. To chair the session, I would like to invite Dr. Akka Mahadevi AS madam, who is a professor and head of nephrology, SDM College of Medical Sciences, Dharwad. Dr. Manisha Sahe madam, who is a professor and head of nephrology, Osmania Medical College and Hospital. She's also the vice president of Win India. Dr. Topoti Mukherjee madam, who's a consultant nephrologist, Manipal Hospital, Whitefield, Bangalore. I request Dr. Topoti madam to introduce our speaker, Dr. Urmila madam.
Dr. Kritika, Dr. Akka Mahadevi may be not joining.
Okay, ma'am.
Thank you, Dr. Kritika. Hello to everybody. Good evening to everybody. It gives me immense pleasure to introduce Dr. Urmila Anand as speaker of the inaugural session of the Win Karnataka chapter. Dr. Urmila Anand is a very eminent nephrologist with a lot of accolades to her credit and doesn't need much introduction in this forum. She is currently the president of Women in India Nephrology Women in Nephrology India. She's also the president of the Southern chapter of the Society of Renal Nutrition and Metabolism. She's currently heading the Department of Nephrology at Amrita Hospitals, Faridabad, Delhi, and NCR. Apart from this, she's also a member of several societies, including the WCN Society, Social Media Team, International Society of Nephrology. She's a CME committee member of the South Asia Regional Board. She's a member of the ISN Educational Social Media Team, member of the Dialysis Working Group of the ISN, and she's also part of the ISN Mentorship Program. Over to you, Dr. Urmila Anand, and thank you for giving the presidential address. Thank you.
I think, good evening, ladies. I mean, all amazing ladies from Karnataka and my colleagues from the rest of the country. I start with congratulating all of you and pay my respects to Dr. Muthu Jayaraman madam, who is present today. This chapter, this journey actually started a long time back, almost 10 years back. We had our fits and starts. We thought of doing this. We had meetings, even a Zoom meeting. But somehow with Dr. Muthu Jayaraman's support, we could take this forward. And we are now more than a year old. So our infant mortality period is over. And hence we can look forward to our future. I'll not say much, but what I have sort of learned over this 1 year of our existence is you should all dream big. What we thought would be a small organization has actually moved forward so much that we have grabbed the eyeballs of the whole world. And as Manjusha and others will let you know, that we are also helping develop the African Association of Nephrologists, Women in Nephrology chapter, and we may support the Latin American group in the future. That's one. Never think that you are not capable of doing something. The second is always work in teams. It's not possible to do something alone. We have all in our own places have worked in silos, but it is only when we came together and sort of looked into each of our strengths that we could crystallize this organization. I'm very privileged to work with many of my colleagues. Each one brings in some unique strength onto the table. Each one does something and provides an asset or a value to this organization. Same way, I am aware that Karnataka now has many talented young nephrologists. I realized today that I was the first qualified woman nephrologist of this glorious state. And it is very nostalgic today to be part of this presidential address. And I am aware and I work very closely with many of you. And you all are very talented. It is just that you have to make time for this organization and see that it flourishes. And at the end of the day, you will be the one who will benefit most. Project yourself, publish in our journal. Dr. Anupam is the editor-in-chief, who's from your state. Make this journal successful, contribute to the newsletters, come to our meetings in national meetings, present your papers, collaborate. I have had the privilege of collaborating with Maitri. I now have the privilege of collaborating with Kritika and others. Try doing that and just grow both professionally and personally. I wish all of you, and especially Renuka, who's been a very close friend of mine over the years, the very best for your organization. Thank you very much.
Thank you, ma'am, for the talk and for laying the foundation for newbies like me. For the next session, we have the presidential address by Dr. Renuka, ma'am, who is the president of WIN Karnataka. For this session, I request Dr. Mayuri, madam, who is a senior consultant and head of department of nephrology, Lokmanya Tilak Municipal General Hospital, and a consultant nephrologist at Hinduja Hospital. Dr. Indu Rao, who is an associate professor of nephrology in Kasturba Medical College, and Dr. Shakuntala V. Modi, ma'am, who is a senior nephrologist at NU Hospitals, Bangalore. I request Dr. Mayuri, madam, to introduce our next speaker, Dr. Renuka, ma'am.
Good evening, everybody, and thanks, Kritika, for those introductory words. We all already know Dr. Renuka, who's an astute clinician. Madam has been a professor in St. John's, Bangalore, from so long and training so many young nephrologists for so long. She has a teaching experience of over 15 years, though she spent her initial training years in Bhopal, but then she has been trained in CMC Vellore under the none other than Dr. JCM Shastri, and she also has a part of her training which was done in Ontario in Canada, because her area of interest is CAPD. And then she has risen the ladder and is a professor today in St. John's, Bangalore, in the Department of Nephrology. And I'm sure all of us, especially the WIN chapter of Karnataka, is definitely going to benefit a lot with a mentor and a teacher at the helm. Welcome, madam, and over to you, madam.
Good evening. Thank you to all for this thing, and a very pleasant evening to all of you, and a warm welcome to the inaugural of Karnataka chapter of WIN India. I am humbled and honored to be the founder president of this Karnataka chapter, and I thank all my colleagues for this. I appreciate the hard work and dedication by Dr. Maitri and team. In a very short time, they have helped us in forming this Karnataka chapter of WIN India. Just on 24th August, he just called me that, madam, we have to make this chapter and we are already delayed. I said, we'll go ahead, and we had a virtual meeting on 1st of September. And in that meeting, we finalized the governing council and executive members. And today is 10th September, and we already have the inauguration of Karnataka chapter. And in that meeting, I was surprised to see the enthusiasm and zeal of all young nephrologists from Karnataka. And I was really surprised. And kudos and hats off to all these young nephrologists. Today, we are having the inaugural function of Karnataka chapter. I know we are in infancy, we have a long way to go, and with this dedicated young nephrologist and with the guidance of seniors from WIN India, I know we will be able to do it with all success. And I also should say that we are privileged to organize the WIN Con 2023 in Karnataka, that is in Bangalore, and we will try our best to give an academic feast and a very good conference. So with this word, I wish all the best and good luck to all my team members, so that we from infancy, we can come from further and we'll make a grand success. Thank you.
Thank you, ma'am. Thank you for bringing Win India to Karnataka. And this is going to be an extraordinary journey for us in the future. Before we move on to the next session, I would like to ask the chairpersons if they have any comments or views from the previous two talks. If there's nothing, we'll move on to the next session, ma'am.
Yeah, so just putting in my best wishes to all. It's really heartening to see such a big start and such a quick start. I personally never expected. We had this discussion a couple of weeks ago, and lo behold, you people are all there. So I know you people are going to do a great job. You have big names there, and I mean, going by the enthusiasm, I'm certain that you will be given a tough competition to the other Win chapters. And at some point of time later, I think we will have a healthy competition among the different chapters of Win also. So we will see, I mean, we can have a clash of wins, so to say, clash of titans, that would be. So I'm very excited, and probably I'll be speaking more during the later part of the discussion. So please go ahead, and thank you for inviting me here as well.
Thank you, Dr. Manisha.
Thank you for your kind words, ma'am. We'll move on to the next session, which is the address by the Vice Presidents of Win Karnataka, Dr. Anupama Madam and Dr. Anita Madam. For this, I would like to invite the chairpersons, Dr. Sushma Rani Madam, who's a Senior Consultant and Head of Sakra World Hospital, Bangalore, Dr. Himamani Madam, who's the Professor and HOD of Mysore Medical College, Mysore, and Dr. Pallavi Patri, who's the Head of Department, Manipal Hospitals, Sarjapur. I request Dr. Sushma Madam to introduce Dr. Anupama Madam and Dr. Himamani Madam to introduce Anita Madam.
Good evening, everybody. It's my pleasure to introduce Dr. Anupama. She's been my senior when I was doing my MBBS, and she was doing her PG in internal medicine. We used to look at her in awe. Okay, so she's an excellent clinician and an academician. She's currently working as a consultant nephrologist at Nanjappa Hospital, Shumaga. She's been instrumental in providing a nephrology care, initiating a nephrology care in the Malnad area since almost about 27 years by now. She has more than 25 scientific publications in national as well as international peer-reviewed journals under her kitty. She is also currently editor-in-chief of Indian Journal of Kidney Diseases. Over to Dr. Anupama.
Thank you, Dr. Sushma, for this kind words of introduction. And good evening to all of you. It gives me great pleasure to be here as a part of the new beginning of Win Karnataka. And every journey needs a first step. And although we wanted to start Win Karnataka from quite some time, we were able to put together only very recently, as Dr. Renuka just said, and we were able to begin today. And it's an important step for us because we are able to walk together in the pursuit, and we hope to walk together in the pursuit of our collective goal of furthering the interests of nephrology, women in nephrology in Karnataka. But the first step is also the most difficult step. Sometimes we take a small step, which later turns out to be a very important step. And I would like to recount a story here, which is partly probably unknown to most of you here. And this happened in KMC Hubli around 1991. As you know from Dr. Sushma's words, I was working as a postgraduate student in medicine. And this was the same time that this event happened. We had this dynamic HOD of medicine, professor of medicine, Dr. Akmahadevi, who is also the patron of Win Karnataka. But probably most of you would not know what is her contribution to nephrology services because of probably most of you are unaware, but I would like to bring it out here that she was instrumental in setting up the first dialysis unit in a government medical college in almost the whole of North Karnataka. Till then, dialysis unit was there only in Victoria Hospital in the government setup, and patients in the North Karnataka region, when they had acute kidney injury or chronic kidney disease, they were unable to avail any nephrology services, and they had to go either to Mumbai or to Sholapur. As far as I can remember, they had to go as far as that. So she realized that there is an immense need for the poor patients to get good care, and she put forward the idea of bringing out a nephrology, a dialysis unit in KMC Hubli. But also this had a lot of hurdles, as you can definitely, you probably are all aware. In a government setup, this involves a lot of hurdles, and also since she was heading the Department of Medicine, there was no qualified nephrologist. A lot of people put forward their hesitations, and they did not want to start the dialysis unit there. There were bureaucratic hurdles as well, administrative hurdles, but Dr. Sushma will agree with me. She was a very tenacious lady, and but for her grit and tenacity, the Karnataka Medical College, Hubli, which is now known as Karnataka Institute of Medical Sciences, would not have got the dialysis unit. So she she overcame all the obstacles, and she started the first dialysis unit in North Karnataka. But there were other problems. Who had to do the dialysis? Which staff had to be trained for dialysis, and how they will be able to overcome all this. And also there were many other problems because the lab was not supportive. There were, at that time, we did not even have an electrolyte analyzer or a blood gas analyzer. So how do we go about with the treatment of these patients? So this was a major hurdle. But she persisted, and she wanted some staff member to go and get the nephrology training, but none of them came forward. And she herself went to Victoria Hospital initially, and later on to even CMC Vellore, and to get the necessary training. And with the training, she came back and started the services. She got the staff also trained, and later on, we had our own ups and downs. We had successes, failures, and however, we continued with the dialysis work. And I had the initial exposure to dialysis as well as femoral. I did my first femoral catheterization in the unit. So this is how we started the dialysis unit. And what she started as a small sapling grew up into a major tree. And now KIMS is the first government medical college to perform kidney transplant. So it has, the services grew from strength to strength. And of course, at that time, Madam was not there in KIMS anymore because she had retired, and she moved on to STM Medical College. But because of her love for kidneys, she asked for herself to be put in the Department of Nephrology, and is now the HOD of Department of Nephrology. And at the age of 82 years, she continues to be active in administration, and she's an inspiration for us, for all of us, because you can see her in the recent World Kidney Day celebration, how she is participating. She inspired many of us to take up nephrology, and this is me doing the first kidney biopsy in the same department. And you can see.
Excuse me, Madam Anupama, Madam, do you have a screen? I mean, you have the PowerPoint to share, Madam?
Yeah.
We are not able to see that, Madam. I think, Kritika, you should stop sharing the thing, Kritika, and let Madam share the PPT.
Yes, ma'am. I'm stopping.
Yeah, please.
Oh, okay. I wasn't.
Madam, please go ahead. Sorry to disturb
Dr. Mahadevi.
Sorry to.
Are you able to see now?
Yes, Madam. Yes, Madam. Please,
yes.
Madam.
This is
yes, we are able to see.
Department of this is KMC Hubli, and Professor Mahadevi, who is a professor of medicine, and starting her dialysis unit.
I'm in a meeting, please.
And this is Dr. Akma Devi participating in the World Kidney Day celebrations in one of probably 2021, I think. So she also inspired many of us to take up nephrology. And this is the true cut biopsy needle with which we did the biopsy, with which I did the biopsy at that time. Just to highlight, not to highlight what I did, but it's just to highlight how primitive the setup was at that time. We did not have even the automated biopsy guns, which we almost take it for granted now. No ultrasound guidance. We had to do an LP needle, put into the patient's renal angle, and then see the movements with the respiration, and then go ahead do the biopsy. So as when this was happening in North Karnataka, in Bangalore, probably by 1995 or 96, we had two other nephrologists joining the women nephrologists joining the work. And Dr. Urmila Anand, as she just said, she's the first qualified women nephrologist in Karnataka. She started work with the Manipal Hospital, Bangalore. And at around the same time, Dr. Renuka started her work in St. John's Medical College. So these are some of the pioneering women nephrologists in Karnataka. Why I brought up this aspect is just to know where you're going, you have to first know where you are. I think many of the younger nephrologists here are unaware of the contributions and even the stumbling blocks in the journey of the women nephrologists in Karnataka. And I just wanted to highlight the work done by Dr. Akma Devi and what she's continuing to do even now, and why she is a patron of our society, of our group. Okay, so now we have, as Dr. Renuka just said, we have a number of women nephrologists, 30 to 40 women nephrologists, and young, dynamic, and enterprising. We definitely have a big responsibility on our shoulders, and we need to look forward to what we can do to the society and what we can do to further the interests of women in nephrology, as well as nephrology itself, and as well as that of the young and upcoming nephrologists. So we will definitely move forward, we will move upward, and yes, we will move onward and together. With that, I would like to thank all of you for this patient listening, and thank you.
Thank you, madam. I request Dr. Himamani madam to introduce Dr. Anita madam.
Yeah. Good evening to all my seniors and colleagues. I take this opportunity on the inaugural meeting of WIN Karnataka to welcome Dr. Anita, Vice President of WIN Karnataka. She is Senior Consultant Nephrologist in Apollo Hospital, Bangalore, and also Managing Trustee of Adarsha Institute of Integrated Nephrology Sciences. I had the opportunity to meet the madam on few occasions. I admire her for her academic acumen, punctuality in attending all the nephrology meetings, and most importantly, her traditional attire. Always she'll be in the traditional attire, which I admire most. I welcome you, ma'am, to address us.
Thank you, Dr. Himamani, for those kind words. To begin with, I want to congratulate the team for having started this chapter, WIN Karnataka chapter, and for all the enthusiasm that was put into this and how quickly we have come to this. I thank you all for having given me this opportunity to serve this organization. Hope I'll be able to contribute something from my side. Women are by nature mothers. So who else can be better to nourish the next generation of nephrologists? So women, what they have that capability is we unite together and we have the ability to bring others also together, nourish them, bring them up, make sure that they also grow, and the group activity is known. Women are known for it. And as nephrologists, we are into most of the departments. What I mean is, we are trained to learn from the basic sciences to genetics, to pharmacology, microbiology, to cancer and transplant and all branches of nephrology, including intervention. That means we are trained in a wide range of knowledge. Now, a combination of a woman and a nephrology, what better can we have than this group? I'm sure this group should be able to do a lot of things. WIN already has a lot of achievements in its pocket already, and we are anticipating to do much more. We have the bylaws already for WIN India, which has thought of preventive nephrology, ethical practice, and many other things. And we are also doing a lot of mentorship, also training the students, plenty of things, I should say. Which other group can be more better than this? So I call myself lucky to be a part of this, and thank you for choosing me to work in this organization. Like what I view about this WIN Karnataka chapter is, yes, we are already started being part of WIN India and started doing most of the things. Just can I think about making more of preventive nephrology, say seminars, or asking the PGs to do certain theses in preventive nephrology, and maybe we should have some sessions in ethical medical practices also. I know there are many other things what we can do, but these were one or two things that just came to my mind as I was thinking what I should be talking as a vice president. So thank you for giving me this opportunity. Let us all together go through this academic journey, and all the best to all the members for our future ventures. Thank you again.
Thank you, ma'am. Thank you, ma'am, for being a role model to all of us. Our next session is introduction of WIN Karnataka Council members by our star player, Dr. Maitri Shankar. To chair the session, I invite Dr. Manjusha Madam, who's the professor and head of nephrology, Gandhi Medical College, Hyderabad. She's also the General Secretary of WIN India. I also like to invite Dr. Suma Raju, who's a consultant nephrologist, Narayana Multi-Speciality Hospital, Bangalore.
Yeah, thank you. Thank you, Kritika. Thank you so much. So I take this opportunity to introduce to all of you. I know everybody knows Maitri, but then it's my privilege to introduce Maitri to all of you. She has lots to be spoken about. But then in short, I can say she has been the driving force, has been in touch with me since the time of inception and conception of this idea of start of the WIN Karnataka chapter, has been driving at a super speed. I can say she's a superwoman. But the formal introduction is she is Assistant Professor, Department of Nephrology, Institute of Nephrology, Bangalore, India. And she's also gold medalist. And then she has she's extraordinarily active in the social media. She's the program director, associate program director of Nephrology Social Media Collective, member of Glomcon Fellowship, member KI Reports Community Editorial Board, member ISN SOMI team, and then of WIN India Visual Abstract Creator and principal investigator in certain research projects, as well as good number of publications to her credit. I know Maitri is going to drive this WIN Karnataka chapter in a successful way. So over to you, Maitri, for introduction of the council.
Thank you so much for the kind introduction, ma'am. Is my slide visible?
Yes, Maitri, please go ahead.
At the outset, I would like to thank WIN India, Dr. Urmila ma'am, Dr. Manjusha ma'am, Dr. Swarnalata ma'am for being so supportive and encouraging us to initiate WIN Karnataka chapter. I was quite apprehensive initially, but I still remember Urmila ma'am was like, Maitri, we are there to guide you. Don't worry. There are amazing women nephrologists in Karnataka. Get them all together. And then I made a few phone calls to Manjusha ma'am. I didn't know what to do. And she was kind enough to receive my calls each time I called her. Sometimes I've called her thrice or even 4 times in a day, and she's been very patient and she's guided me. And there were times when I would just give up and sit, and then she would give me a push. No, Maitri, set up the Google Meet, set up the Zoom Meet, send me the committee list. No. And then she literally held my hand and navigated me through this. We are still in our initial stages, and we continue to lead her support in the future as well. Swanalata ma'am was always there helping out with the invites and the technical team, motivating and inspiring us. I think this is what we all need, a little bit of motivation and inspiration for each other. Then I started calling all the senior and young nephrologists of Karnataka. But the response I got from each one of them was so positive. All of them amazing ladies, filled with enthusiasm. They just wanted Win Karnataka to form and go forward, giving all the positive vibes. I then realized that Win Karnataka is such a robust and wonderful team, and we have a lot of potential. I consider it my pleasure today to introduce our team to the whole of India. But before that, a few snippets for our youngsters on why do we actually need women in nephrology. So why women in nephrology? If you look at Karnataka, we have 20% of nephrologists in women who are in Karnataka who are women, and most of them are in their younger age group. According to a report from CJASN, gender pay gap is for real. 15% of women nephrologists are paid lesser compared to the male counterpart. And women received lesser research grants. Men published more journal articles. 80% of peer reviewers were men, and only 20% of editors were females. Also, very few women leaders. International Society of Nephrology had 24 male presidents, while only 2 female presidents. ASN had 49 male presidents and only 2 female presidents. Of course, Indian Society of Nephrology, it is disheartening even here. This is from ASN Kidney News, and it says that women were less likely to self-nominate for leadership roles. I would encourage all of you to nominate yourself for leadership roles. You're all wonderful leaders. Women received lesser prestigious awards. Scientific Programming Committee and other committees were heavily dominated by men. Prizes were nominated by and won by men. Lesser number of female conference speakers were also noted. This report is from Mint, which shared the condition of working women in India. Working women in India have been impacted more than their global counterparts, and they battle the strongest gender bias across Asia Pacific countries, fighting for both equal pay and opportunity. According to the LinkedIn Opportunity Index 2021, in India, 85% of working women claim to have missed out on an opportunity because of their gender. Women are good doctors, in fact, better. I'm not saying this. This is from a study. In a study of elderly hospitalized patients, those treated by female internists had lower mortality and lower rates of readmissions compared to those cared for by the male internists. Also, women are outstanding leaders. Research has shown that women's presence in leadership was associated with a more participatory leadership style and greater motivation, innovation, and productivity. This was the visual abstract I had created for ASN Kidney News. There are a lot of challenges that women face. Maternity leave issues. Not everyone gets paid maternity leave. Childcare, we don't have a childcare system at our workplace. Lactation groups. We have to balance our household work as well. Care for the family. Of course, COVID-19 pandemic has affected all of us. So how do we improve the conditions for women at the workplace? Striving for gender equity in leadership should be high priority for organizations and will benefit all key stakeholders, both men and women alike. So the organizations should strive to support their women employees, try to provide them with opportunities and support them, if not, at least not sabotage whatever opportunity they have gained through their own merit. Prioritize research into the current barriers and facilitators for women in nephrology. Institute family-friendly policies like addressing paid parental leave, flexible training and practice, breastfeeding support, childcare services, and carers leave. Address gender bias, discrimination by implementing unconscious bias training, transparent pay practices, and all the boards and panels should have some kind of female quota. Also promote women as leaders by implementing formal mentor programs, sponsorship, systemization of achievement, and flexible leadership training and roles. So Women in Nephrology is an offshoot of the International Society of Nephrology. It was founded in the year 1983 and has successfully helped women to nurture their careers in this field. India has had Dr. Vidya Acharya as the pioneer among female nephrologists. She was not only the first woman nephrologist in India, but the first woman president of Indian Society of Nephrology, the founding member of Indian Society of Nephrology and Indian Society of Organ Transplantation, and one of the few women across the globe with significant contribution in the field of nephrology. On this auspicious occasion, we will pay our tributes to Dr. Vidya Acharya ma'am and move forward to the introduction of WIN India Karnataka chapter. So let's start with the introduction of WIN India Karnataka chapter. Our patron, Dr. Akka Mahadevi ma'am, Professor and Head Nephrology, SDM Dharwad. Coming to the Governing Council, President, Dr. Renuka Satish, Professor and ex-HOD, Department of Nephrology, St. John's Medical College Hospital, Bangalore. Vice President, Dr. Anupama YJ, Consultant Nephrologist, Nanjappa Hospital, Shimoga. Vice President, Dr. Anita A, Senior Consultant Nephrologist, Apollo Hospital, Bangalore, and Managing Trustee, Adarsh Institute of Integrated Nephrology Sciences. Treasurer, Dr. Tapoti Mukherjee, Consultant Nephrologist, Manipal Hospital, Whitefield. Secretary, Dr. Maitri, that is me. I'm an Assistant Professor in Nephrology at Institute of Nephrourology, Bangalore. Joint Secretary, Dr. Garima Agarwal, Consultant Nephrologist and Transplant Specialist, Manipal Hospital, Vartu Road, Bangalore. Dr. Himamani, our Executive Committee Member, Professor and HOD, Nephrology Department, Mysore Medical College and Research Institute, Mysore. Dr. Kritika Mohan, our Executive Committee Member, Consultant Nephrologist and Transplant Physician, Hosmat Hospital and Jyotsna Hospital, Bangalore. Dr. Kritika Murali, Assistant Professor Nephrology, St. John's Medical College Hospital, Bangalore. Dr. Sauroba R, Assistant Professor Nephrology, JSS Medical College and Hospital, Mysore. Dr. Christine George, Assistant Professor of Nephrology, Saptagiri Institute of Medical Sciences and Research Institute, Bangalore. Dr. Pallavi Patra, Head of the Department, Manipal, Sajapur Road. We have a scientific committee of WIN Karnataka. Chairperson, Dr. Arpada Iyengar, Professor, Department of Pediatric Nephrology, St. John's Medical College Hospital, Bangalore. Co-Chair, Dr. Priya Payas, Associate Professor, Department of Pediatric Nephrology, St. John's Medical College Hospital, Bangalore. Dr. Nivedita Kamath, Co-Chair, Associate Professor, Department of Pediatric Nephrology from St. John's Medical College again. Our members, Dr. Shakuntala V. Modi, Senior Nephrologist, NU Hospitals, Bangalore. Dr. Sushma Rani Raju, Senior Consultant and Head, Sakra World Hospital, Bangalore. Dr. Indu Ramachandra Rao, Associate Professor, Kasturba Medical College, Manipal. Dr. Suma Raju, Consultant Nephrologist, Narayana Multispeciality Hospital, Bangalore. Dr. Rashmi SR, Consultant Nephrologist, Manipal Hospitals, Vartu Road, Bangalore. So big journeys begin with small steps. We have taken our first step and we have a long way to go. Looking forward to your continued support and encouragement. Thank you.
Thank you, Maitri, for introducing all the council members. And all the data you presented, 100% agree with you. There's a huge gender bias out there. And they're indeed a dynamic group of women nephrologists out here in Karnataka. I'm sure we can collectively raise the bar much higher. Over to the next speaker.
Thank you, Maitri, for persuading us to be a part of this. So for the next session, I invite Dr. Garima Madam to talk about the way forward, what next, and what the future has in store for us. To chair the session, I request Dr. Rashmi Essa, who's a consultant nephrologist, Manipal Hospital, Bartu Road, and Dr. Kristen George, Assistant Professor of Nephrology, Saptagiri Institute of Medical Sciences and Research Institute, to chair the session. I request Dr. Kristen to introduce our speaker, Dr. Garima.
Thank you, Dr. Kritika. It's been a very exciting evening, especially for a newbie like me. And I literally got goosebumps listening to all the stalwarts of nephrology in the state of Karnataka. And it's been very exciting. And I'm sure we would be having very interesting times ahead for WIN Karnataka chapter. So I'm privileged to introduce our next speaker, Dr. Garima Agarwal. Ma'am is consultant nephrologist and transplant physician at Manipal Hospitals, Bangalore. Ma'am has been a speaker at various national and international conferences and is very active on social media nephrology platforms and has also widely published in various national and international journals. So without much ado, let me welcome Dr. Garima Agarwal to share her views on WIN Karnataka, the way forward. Over to you, ma'am.
Thank you. Thanks a lot, Dr. Kristen. And what an exciting day today for us. I still remember Dr. Urmila Madam visited us early this year, and she met me and she literally scolded me and she said, "Why aren't you girls doing anything?" And encouraged, I think she had an interaction with all of us young nephrologists as well as all of our senior faculty. And look how far we have come, ma'am, with all of your blessings. From a WhatsApp group that started in 2021, we are now on our way to officially registering WIN Karnataka chapter in the Registrar of Societies Karnataka. I'm going to be talking about the way forward. As you know, we are in our infancy and we hope to learn from the WIN India movement. I'd like to call it a movement. Dr. Urmila Madam is right. What started as a little group has now changed the almost the face of nephrology in India. Everyone, everywhere I go, talks of us as the WIN India girls, and I couldn't be more proud. Maitri knows recently we went to a patient advocacy forum and somebody asked us, all of us, to collect together and take a picture of WIN Karnataka. And we felt so proud because we knew that the inauguration is coming. Now coming to what we have planned for WIN Karnataka. So we have over 45 dynamic women nephrologists in Karnataka alone, and we hope we will be a very active offshoot of WIN India. The way forward, as I'd already mentioned, we are on our way to registering ourselves as a society. We will be having annual general body meetings presided by our executive council and hopefully with the active interaction of all of our members. As an organization, our goals are in line with the goals and the ethos of WIN India to promote and encourage women nephrologists to be the best professional versions of themselves in Karnataka and all over. On the local level, we plan to reach various aspects of nephrology. First of all, we have planned to reach our nephrology residents, both men and women. As you know, Karnataka, being a medical education hub, has several active nephrology residency programs running. And WIN Karnataka aims to conduct regular academic sessions like case presentations presided by our senior nephrology faculty to encourage the students for exam preparation and clinical work. For the young nephrologists of Karnataka, WIN Karnataka is hoping to provide mentorship and collaboration. Just by being part of this group and being part of this WhatsApp group, we have access to so many of our senior faculty who can help us in our careers, professionally, in research, etc. And WIN Karnataka hopes to be that platform at a local level across institutions. We want younger nephrologists to be able to present their work and their research. We already have a statewide nephrology group, but I think the representation of women leaves wanting. So I think with WIN Karnataka's regular academic activities, the young nephrologists can also present their regular cases and research that they are working on. We strive to take active part in all WIN India social media activities with our own WIN Karnataka group.
and also provide access to our local young nephrologists and residents to the various national and international courses that WIN India and social media itself gives access to. NSMC, Glomcon, and all, Maitri itself is the program director. So we hope that WIN Karnataka can be a key way in which our local residents can have access to all of these other great platforms out there. In terms of research, with our editor-in-chief of the Indian Journal of Kidney Diseases, the WIN e-journal, being our very own vice president, Dr. Anupam YJ madam. Also, with the guidance of our vice president, Dr. Anita madam, who's already part of several, collaborative research work. We hope that with WIN Karnataka, we can have across institutions research, and maybe hopefully more women-centric in nephrology, which is really lacking from India, and publish it in our journal and promote research at all levels. For all women nephrologists itself, it provides collaboration and interaction. As I said, I've attended several of our state Karnataka nephrology group meetings, and the women attendance is less than 10%. Maybe with a focus on WIN Karnataka, with a focus on these activities, we hope to get access across the board with all of our women nephrologists here. On the patient front, we already collaborated with some of the patient advocacy groups, and we hope to encourage this on days like World Kidney Day, etc. Statewide activities with a focus on patient advocacy, we hope to plan with the WIN Karnataka chapter. I am very happy that in conclusion, we are very proud to host the WIN Icon Annual Conference of WIN India next year in August 2023. We are actively working towards making it a successful program and not to let WIN India down in any way. We hope we keep up the standards set by WIN Icon this year, for which we have already finalized the venue and are on our way working on the scientific program. This is so far the plans that we have made, and I think we will be doing this and a lot more. And next time we will be talking about the work we have already done. Thank you, everyone, and good luck to all of us.
Thank you, ma'am. We're definitely excited for what the future holds and definitely willing to contribute to it. For our next session, we move on to the case presentation. The case will be presented by Dr. Ranjita Strate, who's a senior resident in nephrology in the Institute of Nephrourology, Bangalore. For this session, I invite Dr. Muthu Jayaraman madam, who's a senior consultant nephrologist, Chennai Urology and Robotics Institute Hospital, Dr. Shruti Tapyawala madam, who's a consultant nephrologist in Sir H.N. Reliance Foundation Hospital, and she's also the Joint Secretary of WIN India, Dr. Swarnalata Guditi madam, who's the additional professor of nephrology in Nizam Institute of Medical Sciences, Hyderabad. She's the treasurer of WIN India. I request madams to chair the session. And Dr. Rajita, are you ready?
Yes, ma'am. I'll just share my slides.
Yeah, very beautiful. Yeah, very beautiful evening to all of you. Let me first congratulate the WIN for having an additional feather into the cap, and the WIN Karnataka chapter for the inaugural session. The very purpose of this WIN is to have networking, to know each other and give equal opportunity to youngsters. So I think we can, it's quite obvious with this session, because I believe most of you would not have known about one of the pioneer in Karnataka, Dr. Akka Mahalakshmi. So it was very heartening to listen to the journey. So I mean, I'm also seeing a lot of new faces in this platform. So I think the very purpose of having this WIN is being fulfilled. And I would request, in this team to come up with the two things. One is, Anupam madam, I would request you to come up with the journey of one of the pioneer in Karnataka. So we can include that in the newsletter, coming up newsletter.
Yeah, sure.
Second thing is, I would request this team to contribute to the journey of this the chapter, Karnataka chapter, so that we can include these two in the coming the newsletters. So with that, this request, I would like to now invite the speaker for the next session. That is Dr. Ranjita. She's a senior.
Can I say a few words,
Yes,
Swarnalata?
Sure,
Good evening to all of you. I bring greetings from Tamil Nadu wing of Win India. I'm so happy to see the new Win from Karnataka with so many enthusiastic women. And we started Women Nephrology group in Tamil Nadu many years ago, but we are having a small group. Then once Urmila said we will start in India, we all joined with that. And we are about 70 people in Tamil Nadu, one of the largest group of women nephrologists. I'm so happy as a senior most person. I almost can identify myself with Akini madam, who started dialysis in Karnataka. I too did the same. You all might not have known about the kidney dialyzer, making the boards. We used to make dialysis ourselves, and all those old things many of the young nephrologists might not have known. So we started long back, but it was a great feeling to see all the brilliant women nephrologists in Karnataka very enthusiastically talking about the present and the future of Win Karnataka. I wish them all the best in their future endeavors. Thank you.
Thank you, madam.
Can we start?
Shruti, you want to talk?
So congratulations to everyone, and it is a great start for Karnataka Win chapter. And I would really like to say, like Dr. Urmila said, that it is a year since we started this movement, and it is the movement because I am sure that we are going to go great heights. Dr. Manisha, who is looking after a lot of things in the national WIN, wherein registries are being set up. Anupama is looking after the journal. I am sure we are going to go great heights, but it is, I would say that it is a long way to go, and we have to continue our work without stopping. And I would wish all the best to the Karnataka women, and we all are always there for everyone, each of us. I think let's go ahead with the session.
Yeah. Thank you, Shruti. And let me invite Dr. Ranjita, Senior Resident, Department of Nephrology, Institute of Nephrourology, Bengaluru, to present her case. Over to you, Ranjita.
Good evening, ma'am. Are my slides visible, ma'am?
Yes.
Yeah, it's visible, but it's not in slideshow mode.
You make it into slideshow, ma, Dr. Ranjita. Click here, in the lower down, if you look, no, there is a big box. You can click that, it will become a slide. There. You just went there. At the lower icon, you see this. Otherwise, you start. No issues, ma'am.
I'm here, ma'am.
Yeah, no. Share your screen.
Otherwise, it's fine, Ranjita. You can
You
just
start. Yeah.
You can start with that. It's quite visible.
Okay.
You just share your slides and you can start.
Okay. Good evening, ma'am. Good evening, everybody. Everyone. I really thank everyone for giving me an opportunity for presenting case here. And I really feel inspired hearing all the stories and the journeys about the women in nephrology. Today, I'll be presenting a case about Miss R, who is a 27-year female who is a housewife who visited to INU from
Dr. Sanjit, you have to push your slides down. You have to click down. You have to, next slide, you have to, in your laptop or your computer, press down.
Yes, ma'am. Like I just went down, ma'am.
It's not
my
going.
next slide, is it not visible, ma'am?
The slides are not moving for us, Dr. Ranjita.
Dr. Ranjita, yes, now it is moving. Now
it's okay.
Now is it visible?
Yes.
Yeah, it's visible, Ranjita. Please go ahead.
Okay. A 27-year female who is a housewife who presented to us from Dodbalapura, who was studied up to 10th standard. Like she presented with history of fever since last 10 days and cough with expectoration since last 10 days. I would like to date back my history to 2016. That is when her complaint started. That is like when she was 22-year old and with a married life of 1 year. That time she developed a maculopapular itchy reddy lesions all over the body. The lesions had like it involved whole of the lower limb, upper limb, and also involved face. And these lesions were photosensitive. And the similar lesions she also noticed over the scalp, and this was associated with the hair loss also. And within a span of 1 week, with these lesions, she also noticed oral ulcers and nasal ulcers also. And with the 1 week later to this, she also developed multiple symmetrical small joint pain, which was associated with redness, warmth, and she also gave a history of morning stiffness also, which was lasting for more than 10 minutes. 2 weeks later to this, along with these complaints with the itchy lesions and hair loss, she had visited to a dermatologist nearby, and she was being told that she has a relapsing and a recurring skin problem, which requires lifelong treatment. For that, like she was prescribed sunscreen lotions and oral medications. But after 2 weeks later to this skin lesions development, she had noticed swelling of both lower limbs, which initially started to involve only ankles, and within a span of 15 to 20 days, it progressed gradually to involve whole of the lower limb, and it was associated with facial puffiness also. However, like she never gave a history of chest pain or palpitation or abdominal distension associated with this. With this complaint, she had visited to a same dermatologist to which previously she had shown, and the dermatologist had told her that she has hypertension and she requires further evaluation, and she was referred to us. On further probing the history, she also gave history of urinary frothing, but however, she never had a history of hematuria this time. And no, there was no history of Raynaud's phenomena also, and no history of difficulty in swallowing or behavioral disturbances or history of seizures associated with it. Then with this, she visited to INU, and she was being told that she is losing protein in her urine and she requires renal biopsy. And she was proceeded with renal biopsy, and later she was being told that she requires prolonged treatment, and she was started on oral drugs, and which she remembers that it has a tacrolimus and MMF. With this drugs, she had followed up to OPD every month, and her symptoms by about 4 to 5 months, her symptoms of swelling of lower limbs has reduced, and she has continued her follow-up till 1 year, and after that she lost follow-up. But however, she was continuing her medications. And after this, 2016, she continued medications till 2018. And then in October 2018, she missed her periods for about 1 month, and she visited a gynecologist, and her UPT was positive, and she was told to have a twin gestation. And with this, she again consulted a nephrologist, and she was being told and counseled about the risk of continuing the pregnancy. And as she opted for continuing the pregnancy, few of her drugs which she was taking, it was stopped. She remembers telling two of her drugs was stopped, and pregnancy was continued. In the first trimester, she had episodes of hyperemesis, but however, it was managed conservatively. And in the second trimester, it was uneventful. And in the third trimester, she developed a labor pain at 8 months of her gestation, and she delivered a twin male babies. Male babies were preterm and required NICU admissions and however, never had a birth defects or cardiac anomalies. And later, now the both kids are 3.5 years alive and healthy. With this, after delivering, she visited INU for later, and she remembers that one of her drug, that is tacrolimus, it was switched to azathioprine, and however other drugs was continued. With this, from 2018 to 2021, she continued on azathioprine and other drugs, and she remained asymptomatic till January 2021. And later in Jan 2021, she had a hip pain, and she visited an orthopedician, and she was being told that she has a hip related pain, hip related problem, which has occurred due to the prolonged intake of one of the drug for her systemic illness, and it is secondary to a decreased blood supply. And for the same, she had underwent surgery. And later, when she visited us back, then her oral steroid dose was reduced, and her azathioprine was continued. And from 2021 to Jan 2022, she was asymptomatic. She never had a relapse of her symptoms. Then again in January 2022, she developed left hip pain, and for that also she underwent surgery. But however, here post-surgery, 1 week later, she remembers that she had during her course in hospital, she had a fever episodes which was low grade and not associated with chills and rigors. And she also remembers that she was being told that she had low platelet count and low hemoglobin, for which she received some IV injections. But however, her symptoms didn't improve. And later, within a span of 2 weeks later to this, she had noticed the similar lesions, skin lesions, which she had developed in her previous episode. And this was also associated with swelling of lower limbs. And she was being underwent some blood investigation. And again, she was being told that she is losing protein in her urine. And again, she visited to INU. Again, she came back to INU and underwent second renal biopsy. This time, post to this biopsy, she was being told she requires 6 monthly doses, and she had also received 3 injections during her hospitalization, and she was being advised to continue oral drugs. After receiving 6 monthly doses, she was followed up with azathioprine, and she remained asymptomatic and with the azathioprine. Now she is readmitted to a hospital with fever, which is of high grade, associated with chills and rigors. It is continued type, and also gives history of cough with expectoration with moderate amount of expectoration, which is yellowish to greenish in color. But however, no episodes of hemoptysis, no episodes of breathlessness, and no history of worsening of her systemic symptoms in the form of worsening of her skin rash or joint pain. Ma'am, shall I proceed with examination, or should I summarize?
Yeah.
We can finish
I
your
think
presentation,
proceed.
Rajana.
Yeah.
Okay, to proceed with the examination, she was conscious oriented with a BMI of 19 kg per meter, 19 kg. Her BP was 138/80 mmHg, and pulse rate was 89 per minute. She had pallor, and on general examination, she had hyperpigmented heel plaques over her scalp, and skin showed multiple hyperpigmented maculopapular lesions over the face, which was sparing the nasolabial fold. And the similar hyperpigmented maculopapular lesions was also seen on extensor and the flexor aspect of the upper and the lower limbs, and also on the upper back. Systemic examination, her respiratory system examination, trachea was central, and on auscultation, there was crepitations heard over the right infrascapular area and mammary area. So to diagnose, like she's a P1 L2 with the diagnosis of SLE and lupus nephritis, for which she had undergone first renal biopsy in 2016, and she had received multi-targeted therapy from 2016 to 2018. And in 2018, she had a pregnancy, and which was uneventful without any flare episode. And later, post-pregnancy, she received azathioprine maintenance from December 2019 to Jan 2022. And in Jan 2022, she had a renal and extra-renal flare, and for which second biopsy was done and received 6 doses of cyclophosphamide. And currently, she is admitted for right lower zone consolidation.
Thank you, Ranjita. It was a very nice case. So I think it is a case of SLE, which was not, non-compliant or probably not compliant with her medications and the follow-up. And it was
Yes,
unplanned pregnancy, I believe.
Yes, ma'am. It was unplanned pregnancy. But however, on counseling, she opted for continuing her pregnancy.
So, like, what was the protocol followed in this patient, Ranjita?
During her pregnancy, ma'am?
Yeah, no. Initially, when the first biopsy was done, so what was
first
the report and what was the protocol given?
After her first biopsy, she tells actually it is she remembers telling it was tacrolimus and MMF along with the other drugs, ma'am. So it is multi-targeted therapy, probably involving tacrolimus, MMF, and oral steroids.
Can you tell us the proteinuria, status of proteinuria and renal function like urea, creatinine, and the first admission?
During her first admission, she had presented with the features of nephrotic syndrome, ma'am, in the form of she had pedal edema, and she had at the same time.
I know you have presented. The investigations done. What is the proteinuria amount and the urea, creatinine, other parameters like
her proteinuria, it was 6.7 gram proteinuria, ma'am, during her first biopsy.
First admission?
Yes, ma'am. During her first biopsy, it was 6.7 gram proteinuria with normal renal function.
What about ANA, dsDNA, C3, C4?
ANA was positive, ma'am, and dsDNA was also positive. And ANA, it was a nucleosome pattern, and other histone was positive, and anti-Smith was also positive, ma'am.
C3, C4?
Complements.
C3, C4 both were low, ma'am.
So what did you know the kidney biopsy reports at that time?
It was actually class 3 and class 5, ma'am.
Class 3 to 5?
Yes, ma'am.
What do you mean by that? Class 3 is focal segmental.
Focal lupus nephritis with membranous lupus nephritis.
It's a combination of both.
Yes, ma'am.
Proliferation with membranous nephropathy.
Yes, ma'am.
Yes. And IF?
IF, it was full house pattern, ma'am.
Any crescents at the time?
Crescents was not there, ma'am. In the first biopsy, it was not there.
Was there any induction therapy at that time? Or just all the three medicine together? First time?
As her renal function was normal, it was started with the multi-targeted therapy, ma'am. However, she received the methylprednisolone pulse during her first biopsy.
What is your protocol? Like when do you start multi-target therapy, or can you, begin with the NIH protocol or the MMF or the multi-targeted trial? So what is your protocol? Which are the patients you directly start with? Or I can ask the panelists rather, like whoever is there. So what are the institutional protocols and how do you, treat such patients?
Here, as she had presented to us at the age of 22 years, ma'am, with a married life of one month, 1 year. Like we opted for the when counseled for multi-targeted and cyclophosphamide. Has cyclophosphamide has a risk of infertility. She opted for multi-targeted therapy, ma'am. Here. And
can I interrupt here? This is Mayuri here. Why would we not just use MMF as an induction and as the for maintenance rather than a multi-targeted therapy? You're saying it was class 3-5. It was a virgin case. She had normal renal functions. Why the choice of tacrolimus and MMF? Why not only MMF and steroids? I mean, that is the usual thing that we follow, either ULAR or MMF. So I was just wondering why multi-targeted on the first.
Exactly.
Our
Can you
institution
reply?
in our
Maitri can also help you. The case is yours. No? Yeah.
Yes, ma'am. This was in 2016. Even I had not joined the institute at that time. But during that time, the trial had come out regarding the efficacy of multi-targeted therapy in lupus nephritis, and so they wanted to try and see whether multi-targeted therapy.
Wasn't that the trial that you were talking about was for more of the resistant or the patients who went into partial remission and did not show complete remission?
Not for refractory cases, ma'am. For Chinese population, multi-targeted therapy. There was one trial which showed where they used
primary use of as the first thing, because I know of the
Mayuri, the Chinese study was actually for primary patients, virgin cases.
Okay.
And I think the reasoning might have been because tacrolimus is better for class 5. So they might have liked to have 2. Mycophenolate may not be as effective, or God knows. I mean, it's just a
my only this thing was that did we add to her osteoporosis, TAC and steroids for so long that she's already undergone hip replacements at this age. So, tacrolimus itself also causes osteoporosis. So maybe did we add to her immunosuppression, whatever, the side effects?
I agree with you regarding like class 3 and 5. Class 3 and 5, we could have done just with MMF and steroids. Probably if she had come now, we could have done that. But at that point of time, because of the
it
trial,
was in vogue to try the multi-targeted. Everybody was very enthusiastic about it. Yes.
She went through a successful twin pregnancy. I mean, we can attribute to that to this 3-drug immunosuppression. Probably a benefit of that 3-drug immunosuppression. She didn't have any problem, not even a flare.
And she went successfully with a twin gestation.
Pregnancy, and that's a very, particularly I think there's a class 3 and class 5 combination therapy. And I think probably this has helped her, this 3 drugs. Usually we don't start with all the 3 drugs in SLE unless it's a resistant or they don't show any treatment.
Ma'am, but I think what Maitri is saying is probably that was the time when this we started getting literature of the multi-targeted therapy. So people were tempted to use it. Though I was unaware of this Chinese study for primary, means whatever I recollect, I had read it for refractory or resistant cases. But as she's saying, there was a Chinese
study. I think this was actually done for a primary, and they've compared. They've shown that it is non-inferior. It is equally as efficacious as the cyclophosphamide, and even the infection rate a little lower side compared to the
cyclophosphamide.
So they said it's better, combination therapy is better for the primary. So that's where the reason, probably at particular time people were enthusiastic to use this multi-targeted trial. So that was
they started using tacro after when they started using voclosporin, another CNI, and after that this is also another CNI. And voclosporin is very expensive and not able to use by many, and they started using instead of cyclosporin, and they started using TAC instead of that. That's the history goes by that, because cyclosporin can induce toxicity directly, and also this other TAC is much less. With our experience with transplant, they went from cyclosporin to TAC.
And the point to learn in this is like it's not for induction. The maintenance also they have used
that's the thing. Okay, but is it indicated? That's the thing we have to. Is it right Suppose if would you have started like this? The patient comes with a normal renal function. There is only non-extrarenal manifestation gross and slowly developing or 2 months history of edema. Would you have started all the three, or would you have gone on for the traditional treatment of steroids with MMF? And of course, we won't go for the urolupus therapy, isn't it? What would you have preferred? All the experts in this can say. Now,
one is actually MMF. Actually, we could have tried, ma'am, MMF
with
induction.
With steroids.
MMF with steroids be the first choice. She had normal renal function?
Yeah, that's right. But within 2 years, she has developed this hip problem, no? That's rather bad. Usually 4 or 5 years later, we see patients having this hip problem, steroid induced. And she has developed that. It's because of the combination of tacrolimus and steroids. I don't know.
Ma'am, I would want to ask a question to the senior faculty here. Ma'am, how comfortable are you, and how this thing for stopping steroids? Or I mean, I don't know. I don't have the guts to go lower than 5 milligrams every day, but it's very tempting to go down because the amount of immunosuppression vintage they have. Ma'am, do you advise stopping steroids and just continuing with the MM? Because there's nobody is able to answer that question.
Yeah, exactly. Maintenance therapy is very difficult to decipher. So MMF also they say not to give more than 3 years. I don't know why they want to put that limit. Whereas in transplants we give years together. But now they say in SLE.
Now, how do we stop immunosuppression if the patient is
I think in immunosuppression stoppage is evolving now. Then another concept is doing a protocol biopsy for looking at histopathological remission.
That's right.
Not only the clinical remission.
Yeah.
In fact, a lot of papers have come, and we have published one paper from our own center where we have done a protocol biopsy for 30 patients, and we looked at histopathological remission. So if there's a histopathological remission, then probably we can think of stopping.
Ma'am, how difficult or easy is it for you to convince them?
Very difficult.
That is
very difficult.
The financial part is another thing. It's convincing them to go a biopsy.
No, fortunately,
that question is very relevant. And as Dr. Swanlata answered, it's a very tough decision. And the papers are there in favor and against. But when you are dealing with the patient, it's very difficult, especially in a private sector, a person with no proteinuria at all, normal renal functions, convincing them to do a renal biopsy, which sometimes may end up in complications as well, is very difficult. In academic institute, we do it. We have a huge follow-up of SLE nephritis patients at our center, where we have compared MMF and ELNT versus NIH and all. So SLE management, if done properly, the ladies undergo successful pregnancy. And I mean, to that extent, we are happy. And we realize if the patient is compliant with treatment, if you know how properly you are treating, mostly you have a successful outcome. We have many successful pregnancies in patients with lupus nephritis, many of them coming in the first trimester, some of them being on RAS blockade in first trimester, some of them continuing MMF in the first trimester because they didn't know they were pregnant, despite our telling them repeatedly to use contraception. So these things do happen. But despite that, luckily, we have not had problems, and many of the patients we had continued the pregnancies. RAS blockade was stopped, I mean, in the first trimester without any problems later on. So those things. But the difficult question is steroids, we do go down 5 mg, but whether to stop it, we tried stopping in few patients, and I mean, we had a relapse. So I mean, we have burnt our fingers doing that. So how
long do you just continue the steroids for eternity?
Maitri, I have been in government sector now since 2000. So some patients are on follow-up. And SLE as a lady, and so that is my passion also, SLE nephritis. We've done some work on that, and I mean, I'm not very comfortable. I mean, stopping steroids completely after having few bad experiences. But again, we also do protocol biopsies, try convincing and all. But AZA we generally shift
from MMF to ASA. It's more affordable also, ma'am.
Yeah.
I also agree. I have not stopped steroids for a lot of my lupus patients. And although I take care of the bones, I try to see that the osteoporosis is checked, and with the renal function, which is normal, I always give the bone boosters. We do bisphosphonates, DEXA scans, where the renal function is not abnormal, and we can give bisphosphonates. I've got people who have been in remission for years now, but I have not taken away the steroids totally. A little bit of azathioprine and steroid have continued, especially where they had started with a very bad lupus with renal dysfunction and normalized.
There's a study which shows
I have a question.
which has followed up patients with those who have discontinued and those who have taken medicine. And the relapse rate is about 27% in people who have discontinued all the immunosuppression. Whereas those who are continuing low dose, like azathioprine or 5 milligrams penicillin, it's only 9%. So, but as you said, how long, how much is a very
But
million.
it is like this, that when we do a steroid-free transplant or a steroid withdrawal transplant, we end up giving more steroids when there are rejections. So I believe in that theory that a little bit is not going to do more harm than giving more pulses when there are relapses and flares.
Just to add here on a happy note, that WIN registry, has been approved by REC, and we'll be, opening the training platform, and that's the whole purpose of registry. See, all of us as women nephrologists, we deal with so many SLE patients, and none of us knows exactly what is the correct answer for Indian ladies with lupus nephritis. So that's one of the questions we'll be answering. Praki is another question we'll be answering. So probably within a week or two, you'll all receive the training link. The major hurdle was getting the EC thing. So that's in, principle.
Yeah, Manisha, you have to share that, the institutional ethical
Yes. So because
ma'am, but we'll have to take individual institutes.
Yes. So see, the thing is, the other thing we have done is we have applied from WIN India to an independent ethics committee as well. So that Indian ethics committee can serve for Pan India as well. But again, you are free to apply to your ethics committee. See, we have started all this. The platform is in place, but we had the meeting the other day. Main thing was the EC and sharing of data and all those things. So that's why we have to start it in a proper way so that we don't end up burning our fingers. The intention is good. Exactly question what Mayuri answered. What happens to these ladies long term? What are we doing? We are in different states and we are following different practices. We have so many different experiences, and I think it's going to be a very rich data, what we'll generate, and probably
ma'am, and usually the data from the West does not have the kind of disease we see. What I feel, ma'am, with whatever my limited, because I trained in Calcutta, which is again a lot of lupus work there. And even here, it's, ma'am, they come at a maybe it's because they are not aware, or they come at a later stage. But most of the trials, they exclude patients with creats of more than 1.3. I don't know how many of our patients come with a creat of 1.3.
Absolutely.
Exactly. In fact, the Western literature,
we realize we have such a rich data. All of us, in India, we see so many patients. No other country does that. And our strength is in our numbers. And once we do a longitudinal follow-up these patients, I think we will be the ones producing guidelines, especially certain situations which are common to us but very rare for the other people.
Any experience by anybody with belimumab or rituximab in SLE?
I have used rituximab in a few of my patients where there is a class 5 lupus, and I have found remissions, although I have not stopped the multi-targeted therapy. Because I have few patients where they had a flare, a repeat biopsy showing a class 5 and class 4 and 5 together. So I have refrained from giving big steroid pulses, and I have given Ritux along with the multi-targeted therapy, and the complement levels and the activity of the urine has settled.
How much and how often you give?
So I have given 4 doses of 375 milligrams per meter square to these patients. I did not change the protocol because I didn't want to.
That was every week? Shruti?
Every week I have given for 4 weeks, and then I have continued on a low dose steroid with MMF and with tacrolimus.
Even Retax now they give only low dose, no 100 milligram or 200 milligrams.
I did not do that because it was a severe disease, and I thought I'll just go with 375 mg per meter square.
Ma'am, we have a data of 27 patients who were resistant or refractory disease, who were like patients who were, partially remission or worsening. But when we analyze the data with rituximab, the same protocol that Shruti followed, 375 per meter square, we did not really.
Many studies show that Retax is not as.
I know, but when you are faced with a flare and you are already on a multi-targeted therapy,
so we did not give multi-targeted therapy. We had given like either MMF, or either the ULAR or the MMF, and then we went for these 4 doses of Retax, and a very small number. We just have 27 patients, and they were all either resistant disease, refractory disease, or patients who were in partial remission. But we did not really find. We could not kind of halt the.
So these patients just now are showing a response to the complement levels and all that. So at least for these patients, it's working.
As Manisha madam said, we need to.
It will have to go to the registry, and it will have to be evaluated.
The registry, that is going to be our answer for everything.
Ma'am, Dr. K.L. Gupta sir
experience.
Yes. Dr. K.L. Gupta sir has posted a comment in the chat box. He says we can stop steroids if patient is doing well without any activity after 5 years of disease inactivity. I did stop in some of the patients.
I think it will require a lot of bravery on our side to try doing that. So the temptation is there to stop it because it's steroids, but I don't know.
So what is the newer therapy has shown to us that it has postponed the ESKD onset, end-stage renal disease. So more than 10 years, by 10 years, 80% of them going for renal failure, especially class 3, and class 4 go into renal failure, 70% by 10 years, they say. As the combination therapy, multi-targeted therapy has improved the survival of this patient. Any idea?
Ma'am, nowadays the patients are surviving longer. Surviving longer, and even all of them are not progressing to CKD, provided they are managed properly according to guidelines, and you change the regime whenever it's required and whenever they are not responding. What I think it's proper follow-up is important, and literature also mentions without any immunosuppression, with steroids alone, those figures are very common. Then after the introduction of cyclophosphamide, that story changed 50%, 40%. But now, even we have so many patients, SLE patients on follow-up, doing pretty good, going through successful pregnancies also. And I'm talking about follow-up 10 years plus. So they are doing quite well. But only thing is those cases which are refractory to treatment and we are not able to curb the proteinuria, those are problematic cases. And those who go for unplanned pregnancies, those are problematic cases. Another important thing to realize is in SLE pregnancy, always to be on the lookout for APLA, Rho antibodies, that is SSA, SSB, ROLA antibodies, because those things, as the numbers of SLE nephritis patients which we manage, those who undergo pregnancy are increasing. We are seeing these patients also where we had 2 patients with heart block, and the children, the fetus, fetal bradycardia, and APLA syndrome also in syndrome, not only the presence of APLA, but APLA syndrome also in roughly around 10%, where we had to give them anticoagulation throughout pregnancy. But if you are quite aware of the SLE protocols, the protocols are really good nowadays, provided you do repeated, we do eye examinations to look for both the steroid toxicity as well as the HCQ toxicity. HCQ should be continued, 6 mg per kg, that's mandatory. Many of the people stop it. So that is important. Taking care of photosensitivity, asking them to use sunscreens, all those things are important. Supportive care is important. Vitamin D therapy, calcium therapy is important. Monitoring bone mineral density by DEXA is important. So it's not just that we give immunosuppression and forget about the patient. The care should be a total care, and generally the outcomes are good. So that's
what are the parameters you do to monitor the therapy, whether proteinuria or the antibodies or proteinuria? What is the parameters you use to monitor the progress of the disease?
Apart from the, proteinuria and the creatinine GFR, we look at dsDNA and complement levels most of the times. ANA, as we know, is not a very good marker of activity. And proteinuria also by itself is not a very good marker because it can occur in chronicity as well, apart from becoming high in an active disease. So generally complement levels, dsDNA levels, and obviously proteinuria and eGFR, these are the things we follow. We also have a look at the urine sediment frequently. And we also do the clinical scoring. So to have an idea, we have good clinical scores, objective scores available, so that they help.
Many studies show proteinuria is as an indicator of a response to the therapy. And they go by that, by 25% if it is reduced by 6 months. And that shows a better, less risk factor like that. Some of the studies have shown that by the reduction of the proteinuria by 25% or 50% or 80% is indicate the progress of the disease and outcome. I don't know whether anybody has done that here.
Ma'am, I think the other practical point also is that we have to extrapolate the data from the Western world. They go for that reduction in proteinuria, reduction of creatinine. I think in our circumstances, even if we save the patient from dialysis for the next 1 year, I think we have done a good job. I think that would be the practical aspects for us as Indian nephrologists, because the whole backlog of, especially these are women, and the healthcare reaching the women, again, that gender disparity would be something that we will have to practically face in diseases like trachea or lupus.
And unfortunately,
ma'am, we're running out of time. We'll end this in another 2 minutes, ma'am.
Okay.
Yeah, another important challenge what we face in managing patient and what's important cause of the patient loss is the infections. So particularly with refractory cases, we keep on adding immunosuppressants like multi-targeted and rituximab, and ultimately we lose the patients because of infection. That is an important thing. We should be able to balance the disease activity versus infection.
I would like to end the talk by wishing you all a great future for the Karnataka unit, and thank you for asking me to come for this unit. All the best. Thank you.
Thank you, madam, for coming. I thank all the chairpersons for being here today. A lot of encouraging and kind comments in the chat box. I thank everybody.
Before Kritika, you hand over to Sauroba, I just have a couple of announcements to be made. See, one is the fire ring discussion that we had just now about the pregnancy. So I'm pleased to announce that there is a Twitter space chat coming up on 14th regarding the parenthood with kidney failure, wherein Professor Liz Lightstone as well as Professor Shilpa Jesudasan are participating. Kindly participate. This is on 14th September, 7 p.m. IST. Apart from that, as far as the Win India is concerned, we are going to release the guidelines regarding the state chapters, starting from the registration of the particular state chapter, as well as the PAN account, as well as the bank account creation, and of course, going ahead with certain activities. So these will be put up in our website shortly in the next week. That's one as far as the state chapters are concerned. And Win India is coming up with another activity as we are continuing with the convention of the monthly activities on 28th September, if I'm not wrong. This will be done by Dr. Shruti and Dr. Swarnalata. This is on 28th September. And I'm also pleased to announce that the Win TS chapter is holding its first webinar on next Saturday, that is 17th September, wherein we have 3 international speakers. So I request the Win Karnataka also to take the same lead and go ahead. And I request all of you to join for the forthcoming event so that we make a big group. And please follow the state chapter guidelines that would be released and put up in the website shortly.
I would like to invite you for the first anniversary of Tamil Nadu chapter, which is to be held on 29th and 30th of October at Aircard. We'll be happy to host you all for the meeting.
Congratulations, madam. Congratulations. Very nice. Yeah, you are the first state chapter hosting the first annual state conference. Congratulations to you and your team, madam. And we request all the teams. I see the team secretaries who are here, as Karnataka as well as Tamil Nadu. Dr. Anshin is also there in the audience. So we will definitely put up the guidelines. Please go through that and do it accordingly so that we are all inclusive and give an effective and good outcome over a period of time. Over to Kritika. Thanks, Kritika.
Thank you, madam. Before we move on to the vote of thanks, would any of the other chairpersons like to say anything, share their views or comments?
Dr. Shakuntala Modi, ma'am, Dr. Rashmi.
Dr. Anita madam has shared an idea in the chat box. She wishes to start a nephrology family tree with teachers and their students. Madam, would you like to say anything about this?
Yeah, this was just a thought. I thought we will make a registry of all the nephrologists that we have in India, and also probably their family tree. I mean, you would like to tell who your teachers are and you want to respect them. I think that's a gratitude towards all our teachers from the beginning. We have had so many pioneers, as we already came to know about Dr. Akka Mahadevi. They have put in so much of efforts before us. I thought it is a very good idea to just make a family tree. We will include men, women, everybody throughout India. That will be a wonderful thing. As Dr. Manisha has already said, this was never done before. That's why I thought this idea will be a good one. I'll be sharing a small questionnaire asking everybody to tell about their teachers. I mean, name the teachers under whom they have become a nephrologist, and probably they can share their colleagues or seniors, juniors name, so that I need an overlap so that I don't miss out on anybody's name. I'll be welcoming any of you to give me more suggestions towards this.
Is this only women teachers or?
No, I said we will include all of them. No, let us not have a gender bias. We are a strong women group, but we will include all of them.
Yes,
can others also comment about this?
I think, madam, it's a good idea. Let's see. You start with Karnataka and then we get all the women. I mean, it will be women nephrologists and their teachers, isn't it, ma'am?
No, I thought we will have everybody. We'll have everybody.
That may be a massive exercise because we have more than 2,000
we are women in
nephrology,
nephrology, so we should stick to women nephrologists and how they have been taught by their teachers in their career.
Their trials and tribulations in their learning.
Yeah. No, I think we'll be able to make it. I know it is tedious.
Madam, some people may not have women teachers. I mean, they may be trained by male nephrologists.
Exactly.
So will have to be we will have to include males and
include males. Saying
include
all
males
women
in their
nephrologists
teachers.
and their teachers. Mentors can be any. Yeah.
We can be trained by male teachers, but our male teachers had female teachers. So my teacher, for example, had Dr. V.N. Acharya, and Dr. Acharya is my grandmother because she then adopted me. So I would say that all of us women nephrologists can have our family tree and we can showcase it. Like Dr. Urmila will agree that, Dr. Joan Bagman, Dr. Catherine, all these people, when we went to Canada also, we had women teachers who are very strong, who have
really supported us.
Molded us.
Yeah. But then I can also not give up saying that Professor J.C.M. Shastri was my teacher.
Correct. So that's what I'm saying, that we as women nephrologists, we will respect all our heritage tree is what I'm saying.
But we do it for us, Anita, we do it for all the women nephrologists.
Correct.
300 of them. We can request these women nephrologists to let us know who are their mentors and teachers. That is gender neutral. There is nothing to do with gender in that.
Yeah, correct. I think we will start. I agree that it's going to be a tedious work, but I'm ready to do that.
What I suggest, Dr. Anita, see, you probably can start with the Karnataka chapter and also conduct a meet with all the salient women and eminent women of nephrology of India, take their inputs and start constructing to the pan-Indian scenario too. So, I mean, obviously it's a big exercise. So let's start with the small steps, start with the Karnataka chapter because you have good group of women. So you'll show
Yeah.
the model to us, to the rest of the Win India. I think inputs will be definitely given, because at the moment we had given a lot of inputs. I'm sure once you organize a Google Meet, a lot of inputs will come. And then you construct on that so that it becomes a feather in cap for Win India as well.
Okay, sure. We'll do that. I think, as you rightly said, this is not done any time in the past. It's going to be a real good one. And let us try to put in, but worth it, because we all want to respect our teachers for it.
I would like to just add one thing, madam, if I'm allowed. We can actually involve men who are associated with us either as our mentors or as our students.
Okay. Yeah, sure.
Thank you, madam. So we'll move on to the last session of today, a vote of thanks by Dr. Sauroba Rajana. She is an assistant professor of nephrology in JSS Medical College and Hospital, Mysore. Dr. Sauroba, over to you.
Thank you, Kritika. So, good evening, one and all. This truly has been a memorable evening in many aspects. It's with a great sense of pride that we bring forth the Win India Karnataka chapter inaugural meeting today. To draw curtains to this inaugural ceremony today, it's been a wonderful program and a wonderful journey so far. I'm privileged to be a part of this team and to propose the vote of thanks today. First and foremost, I would like to thank the entire team of Win India, the central team, particularly our founder president of Win India, Urmila ma'am. Ma'am, thank you so much. You have been the backbone of all our activities. You have made sure Win India stands where it is today. In such a short span of time, we have built this exclusive network of women. We had a wonderful time in the Win India National Conference last month. Thank you so much, ma'am. And thank you for supporting Win Karnataka chapter to this extent today. Thank you. So I also thank our Win India Vice President, Dr. Manisha ma'am. Ma'am, it's always a pleasure to listen to you. We benefit from your scientific experience, your suggestions. Thank you for sharing your valuable time with us today. No words can enough be said about our dynamic Manjusha ma'am, General Secretary of Win India. Ma'am, you have been kind enough to answer all our queries, to support us, to teach us, to guide us, and to mentor us. Thank you for being with us today. Swarnalata ma'am, Treasurer of Win India. Ma'am, thank you for bringing in the academic flavor. And as always, it's a pleasure to have you with us today. Shruti ma'am, Joint Secretary of Win India, thank you for being with us today. Without the support of this entire Win India team, this mammoth task would not have been possible, and that too in such a short span of time. And we are proud to host the Win India National Conference next year. Senior nephrologists from other states, Muthu ma'am from Tamil Nadu. Ma'am, thank you for being with us today and for helping us in the case discussion and bringing in the academic flavors to this session. Also, congratulations to the Win Tamil Nadu Society. Thank you, ma'am. Mayuri ma'am, thanks a lot for joining us today despite your busy schedule. And that was an interesting session. Thank you. We were honored to have you with us today. Our own senior nephrologist, we are honored to have Dr. Akamadevi ma'am. It was such a pleasure to learn about you, ma'am, and we really look forward for your support and continued guidance. Thank you for agreeing to be the patron of Win India Karnataka chapter, and we really look forward to your guidance. So I'm extremely privileged to also thank our founder president of Karnataka chapter, Renuka ma'am, for her dynamic leadership and support all throughout. Ma'am, you have been supportive. You have been nurturing us all throughout, right from our residency days. She's been my go-to person whenever we have had multiple issues, be it small or large in the department. We look forward for your support. Thank you so much. And it's such an honor to be your student today. Anupama ma'am, it was great to listen to you. Thanks for letting us youngsters know about the earlier days of nephrology and introducing Akamadevi ma'am to us. And indeed, as Anita ma'am said, to nurture is in the nature of women. We hope to fly high under your leadership, ma'am. Thank you for being with us today. To borrow Manjusha ma'am's
words, Dr. Maitri has been the superwoman, and no words can do justice to what she has done over the past few days or over the 2 weeks. She has been the driving force, the primary collaborator for this entire program to pan out the way it did. Thank you so much. It is a pleasure to work with you, and we assure you of all our support. I also thank Dr. Garima, Dr. Tupoti, and all my colleagues and seniors and friends among the Win Karnataka chapter for putting together the program they did today. All the members, Indu ma'am, Shakuntala ma'am, Sushma ma'am, Himamani ma'am, Pallavi ma'am, thank you for being the chairperson, for sharing your valuable Saturday evening with us and putting this program together. Christine and Kritika, you have been great friends, and thank you for coming along and helping us put this program together today. Ranjita, thank you for that academic case presentation. It was a very clear and crisp presentation, and it brought forth a useful discussion to all of us. I also take this opportunity to congratulate all the team members of Win Karnataka and scientific co-committee members. Together, let us take Win Karnataka to new heights and to, of course, have some healthy competition with other state chapters, particularly Tamil Nadu and Telangana seem to be posing strong competition to us. And let us fly high and stay true to the Win India's central and core mission. Though Win India and Win Karnataka as an offshoot is spearheaded by women, we are thankful to all the men who have been supportive and who have also taken part in the audience. I could see Gupta sir, Girish sir, Kiran sir. Thank you all for being with us and supporting us. We look forward for your continued support and encouragement. And last but definitely not the least, thanks to Siddharth for putting together this program without having any technical glitch. The audience and association is generally only as strong as its members are. So together, let us unite, fly high, and hope we take Karnataka chapter of Win India to new heights. Thanks, everyone. Thank you.
Thank you so
Over
much
to you,
for
Kritika.
your kind words. With that, we now end our meeting. I once again thank all of you for being here and making this happen. Win Karnataka is off to a great start, and I'm hoping the journey is even better. So thank you all and have a good night. Thank you.